Hi, this is Vijita Anish, nurse instructor at Athena Coaching Center. Here again, I am with a question. So, I always like to discuss questions. So, this is the question discussion video. So, here is the question. A 4-year-old client with a tetralogy of load seen in a squatting position near his bed. So, here 2 points you have to remember. One is squatting position and tetralogy of a load. So here, 4-year-old child, diagnosis is tetralogy of a load and in a squatting position near his bed. And what is the next? What is the nurse's response? Okay, when you approach any question, you should understand the basic content, which is a disease condition, and the entire situation of the child. First of all, when you understand the situation, then directly you can select the answer. So please remember what is tetralogy of load. It is congenital cardiac disorder. It is a cyanotic disorder where in tetralogy of load there are 4 associated conditions. Tetralogy of load is consisted with overriding of aorta, ventricular septal defect, pulmonary stenosis, and a right ventricular failure. Okay, so what happens here? Because of tetralogy of load, in that what all conditions are there? There are 4 conditions, right? Overriding of aorta. Basic important thing is overriding of aorta and pulmonary stenosis. Okay, these are the 2 main important things. Overriding of aorta is a situation where the aorta, usually it has to originate from left ventricle, but it originates from the right side. Fine. So, because of overriding of aorta, there will be always ventricular septal defect. Pulmonary stenosis is a condition where the pulmonary artery is narrowed. So, pulmonary artery is not able to collect the entire blood from the right side, right ventricle. Clear? Now look at this. Overriding of aorta is this. This is aorta, but it is just deviated towards the right hand side. Pulmonary stenosis is this. This is pulmonary artery, but it is narrowed. Okay, so narrowed pulmonary artery causes right ventricular hypertrophy. Okay, overriding of aorta causes PSD. So because of this, what happens? The blood gets shunned from right hand side to left hand side. Right side of the heart is having deoxygenated blood, whereas left side of the heart is having oxygenated blood. Now, because of this shunting, what happens? Aorta receives deoxygenated blood. Remember, the right side of the heart is having deoxygenated, okay? Left side is oxygenated blood. Fine. So, aorta receives what kind of blood here? Deoxygenated, because deoxygenated blood is coming and mixing with the oxygenated blood. So, aorta receives deoxygenated blood. Okay. So, here aorta receives deoxygenated blood. So, what happens? Tissue perfusion impairs. Okay. Very important thing. This is very, very important thing. Aorta, which receives deoxygenated blood, and what will be the output? As a result of this, hypoxia and or tissue perfusion impairs or decrease. Okay. So because of impaired tissue perfusion, what happens? Cyanosis. Okay. This is what is happening in tetralogy of Fallot. Okay. So this particular child is having cyanosis or impaired tissue perfusion. So as a compensation, the child assumes the position called as squatting. Okay, now we have to think about the squatting position. What is squatting position? It is a position in which body pressure is converting or it is transferring into the lower extremities. Squatting position, it is the position in which our body weight or the body pressure which is transferring to the leg. Okay, so that is considered as a squatting position. It's a very simple when we sit in a Indian commode. Okay, or when you are sitting in a lower floor with your leg. Okay, that is squatting position. Why the child assumes squatting position? When with a squatting position, the pressure increases into the lower extremities where the blood vessels constrict, so the vascular resistance increases, so shunting can be prevented. Already we said shunting is the reason why there is chances to get a hypoxia because of right to left shunt. So shunting always causes desaturation or deoxygenation very fast, and that is the reason for cyanosis. Okay. So when the blood vessels constrict in the leg or in the lower extremities, the blood supply reduces and the right side pressure always reduces because the blood from the lower extremities are coming to the right hand side. So when there is a constriction in the lower blood vessels, it is not allowing the blood to pass so that the shunting can be controlled. Okay. So squatting position always relieves breathing problem or it relieves cyanosis. So what is the appropriate positional intervention in terms of tetralogy of Fallot is squatting position if the patient is able to sit. But for a newborn babies, definitely it is not possible. So instead of that, what position you can provide the newborn, it is knee chest position. It is almost a similar effect with the squatting. Okay, so here you have 4-year-old child with a tetralogy of Fallot found to be in a squatting position. So what is your better nursing action? Now you can read the option. Number 1, administer oxygen. Number 2, take no action if he looks comfortable but continue to observe him. Okay, I said squatting position will be a position which is literally necessary for cyanotic situation to reduce cyanosis. Okay, and third is pick him up and place him in a Trendelenburg position, which is head low position in a bed. And next is have him stand up and walk around the room. Okay, so what is wrong here? The fourth one is completely wrong because in tetralogy of Fallot, rest is very important. Why? When patient is more active, what will happen? The heart will contract and heart will move very fast. So shunting will increase. So you have to provide a rest for the patient in order to reduce getting cyanosis. So I'll remove fourth option. Okay. And third option is also wrong because when you give Trendelenburg position or low position, the pressure towards the heart will increase. It further increase the shunting. So third one and fourth one, these are wrong answers. And what is second one? You don't do anything and you have to closely observe the child. If there is any problem, yes, you can start intervention. That would be really better and administer oxygen. definitely administer oxygen is a real better answer if you find any kind of hypoxic situation. So far the child is okay. Only the child, we saw the child is in a squatting position, that would be related with a shunting. Okay. So what we need to do is, you don't do anything. You have to just continue observing. And if you feel any kind of acrocyanosis, TET spell, cyanosis, breathing problem, any of those kind of thing, yes, you have to act immediately. Otherwise, squatting position is the true better intervention for tetralogy of Fallot. So when tetralogy of Fallot client, when they develop any kind of cyanosis, what would be the better position is the nursing intervention. So what would be the position? It would be squatting position. Fine. So what would be the better answer? Second one. Fine. Oxygen, yes, definitely you can administer oxygen, but before administering oxygen, you should make sure that the child is having some problem, or really the child requires oxygen. If you are sure with that, you can start oxygen, but here it is not sure. Fine. So, but the situation which is okay and the child is in a safer situation. Okay. Also, since the child is in safer, you can just consider continuous observing, because why I'm pretty sure that, because in tetralogy of Fallot, squatting position is the reliable and very good effective position that always reduce cyanosis. Okay, so since the child is in safe, I would always prefer the second option. Okay, thank you. If you have any doubts, please ask me, and you can just drop your doubts in your chat box. Thank you.